morning. This is Dr. S. Samuel, working as Associate Professor in the Department of Biomedical Engineering at SNS College of Technology, Coimbatore. Now we, the students of Biomedical Engineering, are gathered here to discuss about the case study on diagnosing and implantable organs, particularly in the healthcare field. Let's start the discussion now.
So, I hope you all have heard about the Cambridge University. So, this university is taking care of a particular hospital, not only one. They have been taking care of many hospitals that have been collaborating with them. So, in specific hospitals, they diagnose, they look for implants, they look for treatments, and everything is being specialized for them, and it is completely based on AIs. So, everything has been very good nowadays. So, for example, let's take that they have a barcode there. So that barcode for specific station, they have those data, they'll upload for the patient, and suddenly they'll get the whatever the data that are being needed for those people, they'll get it out. So these data are all collected together, and these are being used for further studies and improvements. So this is how the universities will work. So, in specific to talk about that, this university, the Riverside University, which has been handling all the patients, suddenly noticed a patient with knee pain. So, knee pain is very common for today's generation, but still this person had a very bad knee pain. And when they checked, when they wanted to take X-ray and CT and all, they were able to see there were no adjustments with the bone on, it was all fixed and it was proper. But when they further studied with this CT, then only they knew that there is some kind of problem in the ligaments that are being present in between the bones. So that is very critical stage which you can't see it very soon. So this patient has been accurate, and suddenly when he experiences pain, usually what we do, we use needle. So that is what he used also. But that did not stop there. So now people from that university are being trained to study that processes. So that's what I heard.
Okay, let's talk about my experience in the one hospital, that is in China. In that, the most of the pregnancy ladies is affected by the back pain after the surgery. So they could replace the sacrum in the body because there is no one ready to donate their organs in nowadays. So we can't be able to replace the sacrum by the tissues in our bodies. It will be good for the growth of the after it replaced in the body. It will be easily to grow the tissue, and it will not affect as much as the organs donated by the others.
So I'm going to speak about the lung transplant done in Mayo Clinic. So 45 years old mate was suffering from suffering of breath. So the doctors decided to transplant a lung for his abnormal breathing, and even in rest condition he needs oxygen. He can't do his daily routine continuously. So the doctor suggested to transplant the lungs. So after that lung transplant, he was feel better and improved oxygen supply.
So I'm going to talk about a 52 years old male patient who was in last stage of heart failure. The doctors decided to do artificial transplant because of lack in heart donations. So this was performed by using done by an AI equipment.
Now I am here to talk about the case study about the kidney failure patient. That's Lakshmi. She is affected by the kidney problems. She went to the hospital and she gave the complaints about less urine transplant and tiredness and weakness. The doctor may diagnose by the physical test by seeing the patient physically, and the laboratory test is a urine test be taken to the patient. Then the stage of the kidney is diagnosed by the AI and the doctors. Then the doctor successfully to replace the kidney by the kidney transplant. If she got a donor, it is very simple method to implant the kidney. If she not get a donor from anyone, it is very critical to implant the kidney.
Yeah, we can conclude like that. AI can predict the diseases at early stage. Actually, all the diseases are curable only if it is found at the early stage. For some cases, it is our responsibility to give awareness about the organ donating so that organs can be donated and the life of the patients can be saved easily. Thank you, students.